Hello and welcome to this week's Teach Me Tuesday. My name is Lisa. I'm an experienced nurse and a NICU nurse educator, breaking down big topics into little bits for you. This is part two of thermoregulation in the NICU. So if you haven't watched part one, go back, check it out. We talk a lot in there about the mechanisms of heat loss, about brown fat, about incubator functions, about the importance of watching what's going on with your air temperature when your baby's in skin servo mode. So go check all that out because we're going to build on that knowledge. If you haven't watched part one, I highly recommend you do that. I also recommend that you are paying attention to the little critical moments that we're doing on social media, also posted here on YouTube, but they will give you little insights a little bit further into all of these topics. So let's talk a little bit about ELBW infants. It is important. I also think we as like a NICU society need to come up with something for those babies even like less than 600 grams, like the EEELBW, like extremely low birth weight babies, because they feel even trickier than our VLBW. So ELBW is considered less than 1,000 grams, but even those smallest babies, right? We're using humidity, we are using plastic wraps or ponchos on admission. We are using those things that help us, right? Here's our little poncho. If this little doll was in her poncho, we are working on getting them out of the poncho when their temperature is stable. We've got the top down on the incubator after admission, and we start getting them out of here. Great ways to do that is to uncinch the hat, take one limb out, which is going to be tricky to demonstrate with my little baby here. Doing those small, quick things for them and then getting them in that humidity and really getting them warm. So plastic wraps, great things for admissions for these babies, getting them out of there, after the top's down, they're in humidity, have stable temperature. Things we can do to continue to keep them warm, kangaroo care, positioning devices, servo mode, obviously. We're not going to put them on air mode at any kind of early time. And as we talk about servo mode, I'm just going to remind you, even for these babies, we should always let servo mode do its job, right? So when we are placing the probe, remember, we want to put it not on a bony prominence. So on this little baby, I don't know if she's going to give us a great demo of her ribs, but, well, of course not. So she is not putting her temp probe on her ribs, right? We can put on the liver, best place for a big baby. We can do the armpit. What happens with the armpit is if we don't get it in there, it doesn't always give us the best reading and it falls off. So avoiding those bony areas, trying to get it dry before we put it on with some sort of securement devices. And then if a probe is misplaced, what we really want to do, or if the baby lays on it, right? Maybe you had the baby laying, it's in their right armpit, you put them on their right side. We don't want to react and like be opening and fanning the incubator or popping the top or adjusting the temperature. We want to kind of let the servo do its job. The incubator is going to get them there. Gradual changes are much better than quick changes to the incubator. We don't, and the baby's temperature. We don't want the baby to go from a temperature of 37.8 to 36.8 in 10 minutes. That's not great for a baby. So let that gradual temperature change help the baby. If they're cold, putting something under them, even if you need to put a warming mattress, especially for those ELBW babies, is better than trying to crank up the heat on the incubator or changing it out of skin servo mode. Getting babies out to kangaroo is so great, right? We maintain warmth by being on our parent. Mom, dad, doesn't matter. We want the baby to have the blanket wrapped. That's one of my favorite things about both of these pictures is you can see that the baby is really wrapped within the blanket there. If the baby's getting cold, we recommend changing blankets, putting something around the holding parent to help keep everybody warm, making sure the room temperature is warm. One low temperature is not a reason to jump back into that incubator, right? Let's see what we can do to really modify our surroundings. When the baby gets back in, number one thing, make sure you've changed your mode. If you had taken it off skin servo because you didn't want to listen to it, none of us do, nor does this little baby alarm at you. Make sure you switch it back to skin servo mode when you put it in so the baby doesn't get too warm or too cold, and take a temperature 30 minutes later. How do we know it's time to go from servo to air mode? Some units don't ever do that, right? They just do a transition to a crib in servo mode. That's great. If you have a baby in prolonged incubator and you want to start dressing them, I think servo mode's tricky when you're dressing. So maybe you're 30 weeks, at least 14 days old. your skin is matured, you're off of humidity. Great time to start thinking about getting into air mode. If you still taking care of a smaller baby, it's okay to leave them on there. But if you're 31 weeks, 1,400 grams, we want to kind of normalize some of this, go ahead and transition them out of there. You're going to change to air mode. You're going to get it below this servo reading because you're probably going to be dressing them or using a more intense positioning device such as this. And if we're doing that, we don't need as warm of an incubator. You can leave the temp probe on even just for tracking and trending to make sure the baby's not getting too hot or too cold. Again, we don't want to have frequent temperature changes, but really this is quite helpful and quite warm for these infants, especially if they have a sleeper on underneath. So getting them in here, tucking them in well. I think when you've got this going on and the baby's really tucked in here, it's tricky to be on servo mode. So if I'm here, I'm switching to air mode, even if I leave the probe on for a period of time to monitor and watch for that temp instability. As we are really troubleshooting our air mode or we are weaning to a crib, we want to always pause the wean, go back to skin servo mode as needed, maybe increase our environmental support, reconsider, is the baby ready to get off of skin mode? Is the baby ready to go to a crib? When's the last time I had the baby in the bath? All those things are things we really need to think about as we're doing this. Pause, think, critical moment. Is the baby ready for this? Are they in the best spot? How do we know it's time to go to a crib, right? There's a lot of controversy into this idea of when's the perfect time. I would say the majority of units are right around that 1,800 gram. Some will say you got to be 32 weeks. Really, I think this should be based on meeting criteria. And I think starting to begin a wean at 1,600 grams, I'm not saying at 1,600 grams you take the baby out of the incubator. I'm saying at 1,600 grams we start a wean. Maybe we start dressing them. Maybe we start putting them in one of these. Maybe we switch to servo mode. We give them time. Are they still gaining weight? Are they still tolerating their feeds? Has their temp stayed stable? No increase in their A, B's, and D's, right? If all that's happening, maybe they can get out within a week. Maybe you have a baby who's in here in a 27-degree incubator and you cannot keep them cool, right? Maybe they're saying, I'm ready to be in a crib. When we get into the crib, we're going to dress them in one layer plus a swaddle or a sleep sack. You can keep them in here. We can make our traditional swaddles out of our lovely baby blankets to get them in. And then we want to keep the baby warm while in the incubator. If they're stable during the wean, then we get them out and we move them to the crib. So that's our next step. So now we're in the crib. We don't want to put on tons of layers. We need to be mimicking what the parents are going to be doing at home. So I really, really, really want you to think about that. I want you to think about this idea that if we have to put on 5 layers and a sleep sack to keep the baby warm in the incubator, I'm sorry, warm in a crib, they're not going to be successful at home. And we're already burning too many calories. So let's just get them into a physiologic good place. Also remembering going back into the incubator may seem like a huge step backwards, but a bigger step backwards is going to be if we stop tolerating our feeds, we have A's and B's, we don't do our PO feeds. So let's get to a place where they're going to be stable without having to do that. And then knowing kind of your criteria for returning to an incubator and how that's done is going to be really important for you as a NICU nurse. So how do we tell our parents about all these things we've talked about in the last 2 weeks? We need to tell them why temperature management matters. I will remind you that a baby that becomes hypothermic has worse long-term outcomes. So we want to keep our babies warm. We do not want to get them into cold stress. We want them to have good feedings. We want them to grow. We want to support warmth. We want to be getting them out for kangaroo care. I maintain that kangaroo care should happen on the first day of life for every baby, and I'm going to stand by that controversial topic that I have. So keep that in mind that really you should think to yourself every day, when can the baby get out? Not can the baby get out, but when can the baby get out to hold? How can we empower our parents? Help them during care times, teach them about cares, teach them about transition, using the portholes, not popping the top, practicing skin to skin, bringing in blankets if they want to when the baby's starting to get dressed. That's going to normalize life for them. Outfits that they can wear, blankets that they can have. This is a little quick, you know, table for you. You can screenshot this, go on my social medias and find it. It's just a quick idea of like when should we be using servo, air, weaning, incubator, etc. take it with, what your unit recommends. Make sure you're reading your policies, procedures, and algorithms to know what all the next right steps are. So, thermoregulation is huge. It's something that we do for every single baby every single day. Whether you're in a crib, you're in an incubator, it doesn't matter. We'll be watching their skin, we'll be watching their need for humidity. We're going to watch this idea of getting them off of skin servo mode into air mode. We're going to let the incubator work. We're going to try not to stress the incubator by doing tons of adjustments and confusing it. And remember, we can influence their thermoregulation and their temperature more than we probably think. So, using portholes, using the air shield, right? Putting blankets under them, not over them if they're in the incubator and they need more warmth. Using our positioning devices appropriately to influence their environment. Maybe this is the positioning device you have on your unit. Maybe you're using a Z-Flow. Making sure you understand how to best use these products to help your patients be the most successful. And as always, including parents, especially in daily kangaroo care, is going to be key for thermoregulation in the NICU.